Men wonder if they need to know. They need to know. They need to mostly know for their offspring. It's not going to have much of a direct effect on what we do with them from a health point of view, but it certainly will be something that will be useful for their children to know. It's also worth noting that ovarian cancer and breast cancer in the family is really important, and the age of the onset of cancer is more important. Although I'm going to back off of that, I think we're still learning more about that in the Ashkenazi population. I mean, I certainly am seeing many women who are 60, 70, and 80 years old that I've tested for this gene and found them to have the mutation in this population. And their cancers in their family were not at young ages. And I think all of you can probably recognize the problem with that. First of all, we're missing a lot of family history. Maybe we're missing family history because people aren't talking to each other. Maybe we're missing family history because at the time diagnoses were just difficult to make. I can't tell you how many times all anybody knows is there was some kind of stomach cancer, something in the abdomen, and maybe that was an ovarian cancer, we just didn't know about it. We're missing family history because many people died in the Holocaust, and that information was simply not to be ever available to us in this current generation. So there's a lot of missing information in family history, and I believe that anybody who has a history of breast cancer or a family history of breast or ovarian cancer and is Ashkenazi should consider doing this testing if it's going to impact what they're going to do. Here's how the numbers play out. We already talked about the fact that maternal and paternal family history are just as important. Approximately 2.5% to 3% of the Jewish population carries this gene. Now, it is the Ashkenazi Jewish population, but you know 95% of the Jews in this community and in South Florida are Ashkenazi. And the ones who are Sephardic pretty much know that. So for the most part, I think we would almost interchangeably just say the Jewish population in our community, but it is of that Eastern European descent that we're talking about. So that's a 1 in 40 chance, or a 2.5% chance. That's at least tenfold difference between the general population. So this is an entity, and I'm going to kind of explain to you a little bit of why. We'll see if the rationale makes sense to you. That would be true. Any woman who's had breast cancer under 40 has a 25% chance of carrying the gene. So I think anybody who has a history of breast cancer at a young age should be tested. Now, people ask all the time, I'm Ashkenazi Jewish, I'm Jewish, we have so many genetic diseases, are we just doomed? Should we not marry? What's the deal? Well, the not marry is not true because this is a recessive gene, so it doesn't matter whether you marry somebody who's Jewish or not. But this is the other thought about what the phenomena is like. This is actually called a founder effect, and it's not isolated to the Jewish population. It just happens to be our community has that. There are people, there's a little cluster in Newfoundland, there's a group we think in the Bahamas, any kind of little cluster that goes through this process. But here's what happens. It doesn't matter what the genetic disorder. If you basically have, or imagine this is the original population, and maybe there's just one out of millions of people who has it, and then something happens. There's something that basically causes the population to decrease. Is it famine? Is it disease? Is it war? Is it something else? Then you can end up with a smaller population here. Mutation represents, instead of 1 out of 100, it's 1 out of 4. And then as the population regrows, especially if it regrows together, then you can start to see much more prominence. And based on this kind of data, this BRCA mutation tracks back probably about 750 years.